Hello, my name is Dr. Omide, and I'm going to continue the lecture series of the back. So we had talked about the vertebra so far, general knowledge or information on the vertebra. So we'll specifically go and discuss each vertebra. So we have the cervical vertebra, which are at the neck, and they're the smallest of the 24 movable vertebra, located between the skull and the thoracic vertebra. So the IV discs between the cervical vertebrae are actually thinner than in the other regions, and they are thick compared to the vertebral bodies they connect. So the IV discs are thicker than the cervical vertebral bodies. So why is there greatest range of movement in the cervical area? Because the discs are thick. The articular facets are horizontally oriented, nearly horizontally oriented, and there is small amount of surrounding body mass. In the neck, you have very little surrounding body mass. Then the cervical vertebra have articular facets that are almost horizontally oriented, and the discs are thick. So those are the factors that ensure great range of movement. So cervical vertebra have oval transverse foramen in their transverse processes. We call this foramen transverse area, and this usually transmit vertebral arteries and veins, except the one of the seventh cervical vertebra. It's usually very small, so it only transmits a small accessory vein. So the transverse processes have an oval foramen transverse area that transmits vertebral artery and vein, except C7, where you only transmit a small accessory vein. These transverse processes end laterally in two projections, which we call tubercles, for attachment of levator scapular and scalene muscles. We also have grooves on these transverse processes between the anterior and posterior tubercles. These grooves are for the anterior rami of cervical spinal nerve. So these are the how you describe the transverse process of cervical vertebra. So this is the transverse process with foramen transverse area for vertebral artery and vein, except in C7 where it transmits a small accessory vein. Again, this is your foramen transverse area. The cervical vertebra also have carotid tubercles. Cervical vertebrae have carotid tubercle, and this is a tubercle of the sixth cervical vertebra, specifically the sixth. Why is it important? The common carotid arteries can be compressed here. So if there is bleeding and you want to control the bleeding, you go and compress the common carotid artery over the tubercle of C6 to reduce the bleeding. So the bleeding may continue because the carotids actually anastomose with other distal branches, but which will be at a slower rate. So you can actually control bleeding by compressing common carotid arteries at the tubercles of C6 vertebra. So this is your C6 vertebra, okay? And this is the tubercle on the transverse process. So we call this the carotid tubercle of Chassaignac. It's on both sides. Again, this is the tubercle or carotid tubercle. Then, so what are the features of a cervical vertebra? The body is usually small and wide if you check from side to side than anterior-posterior. The superior surface is concave with an uncus or uncinate process, which is the inferior, and the inferior surface is convex. So superior surface is concave and inferior surface is convex. Okay, this is the uncus or the uncinate process. So superior surface is concave and inferior surface is convex. The vertebral foramen is large and triangular, while the transverse processes have foramen transverse area, but this may be absent in C7, and this foramen transverse area in C1 to C6 transmit vertebral artery and vein, as well as sympathetic plexus. But in C7, foramen transverse area transmits a small accessory vertebral vein. The articular processes, superior ones face superior posteriorly, inferior ones face inferior anteriorly. So this can be brought in your MCQ. The spinous processes of C3 to C5 are short, but C3 to C6 are bifid. The one for C6 is long, but the spinous process of C7 is actually longer, and we call it the vertebra prominens. So we have typical cervical vertebra and atypical. So typical, we have C3 to C7, This contains a large vertebral foramen for the spinal cord. Why is it large? Remember, that's where you have brachial plexus, okay, which are a collection of nerves that are going to innervate the upper limb. Then we have vertebral body of this typical vertebra. This vertebral body are usually transversely elongated with a superior border and an inferior border. Then articulation of adjacent vertebra, we have nearly horizontal articular facets, and this increases the range of movement, permitting flexion and extension but restricting rotation. The elevated superolateral margins of typical cervical vertebrae usually have an uncus, which we call the uncinate process. Elevated superolateral margin has an uncinate process, while the spinous processes of C3 to C6 are short and bifid, mainly in white. The C7 has a prominent spinous process. C7 vertebra has a long spinous prominent process, which we call the vertebra prominences, and it's actually palpable. If you touch the lower part of your neck at the back, there's a palpable spinous process. That's the vertebra prominences. So you can see the C7, this is the vertebra prominence, okay? And these are the typical vertebrae from C3 downwards. And you can see they have a bifid spinous process, okay? And we said next we discuss the atypical cervical vertebra. So we'll start with the first one, which is the atlas. So atlas has no body, but no vertebral body and no spinous process. It's usually ring-shaped and has paired lateral masses. These are able to bear the weight of the skull. So it has no body, no spinous process. It's ring-shaped and it has paired lateral masses that can bear the weight of the skull. The atlas has transverse processes from the lateral masses. And remember, the atlas is the widest cervical vertebra. Why? You're able to increase the muscle leverage. The articular surfaces, the superior ones, are kidney-shaped. Remember, the atlas needs to articulate with the occipital condyles of the skull. So they're kidney-shaped to allow articulation of the occipital condyles. And the atlas has anterior and posterior arcs. These bear tubercles at the center and extend between the lateral masses to form a complete ring. So the posterior arc actually corresponds to lamina in the other vertebra. And the posterior arc of this atlas usually has a wide groove on the superior surface, and this groove transmits vertebral artery and first cervical nerve. So these are the features of atlas, the first cervical vertebra. No body, no spinous process, it's ring-shaped, paired lateral masses, it has transverse processes. The atlas is widest to increase leverage for muscle. It has anterior arc and posterior arc that bear the tubercles. It has lateral masses that complete the ring. It has the posterior arc with a superior groove on the posterior arc for vertebral artery and C1 vertebra, and it has articular surfaces on the lateral masses that are kidney-shaped for articulation of the occipital condyles of the skull. So this is what we're talking about, the posterior arc with a posterior tubercle, anterior arc with an anterior tubercle. These are the lateral masses. These are the transverse process with foramen transverse area for vertebral artery, and these are the lateral masses, so kidney-shaped for articulation of the occipital condyle. The posterior arc, we said, has a groove for vertebral artery and first cervical nerve. Remember, there is a facet here for the dens. Dens is for the second cervical vertebra, and this is transverse ligament of atlas passes here from right to left lateral mass. We go to the axis. Axis is the second cervical vertebra. It's the strongest, and between axis and atlas you form an atlantoaxial joint, which is pivot. So when you do an up and down movement of your head, then no movement. When they ask you a question, you want to say it should be the yes movement at the atlantoaxial. Yeah, and then if you come to atlanto-occipital, it allows the no movement. Okay, it's a condylar type of joint, and when you come to atlantoaxial, between the dens and the atlas here, it is able to allow the no movement. So yes movement, atlanto-occipital. No movement, which is side-to-side movement at the atlantoaxial, no movement. So the axis has articular facets, two of them on the superior part. It has a bifid spinous process. It has a dens, okay? And this dens is actually the pivot for rotation, and it's held against the posterior part of the anterior arc of the atlas by the transverse ligament of atlas. This ligament runs from right to left lateral masses, so the dens passes between the ligament passes between the dens and the spinal cord. So if the ligament passes here, the spinal cord is here, the dens is here. So the transverse ligament of atlas passes between the dens and the spinal cord, and we say the ligament runs from the lateral masses on both sides. So the dens is housed between the anterior arc of the atlas and the transverse ligament of the atlas. So this dens, the transverse ligament of atlas forms the posterior wall of the socket of the dens, and usually it prevents posterior displacement of the dens, okay, and anterior displacement of the atlas. So if you have your ligament here, it will prevent this dens from dislocating posteriorly, and this ligament also prevents this atlas from moving anteriorly. So the socket of the dens is by anterior arc of atlas and the transverse ligament of atlas posteriorly. So this shows you the second vertebra. These are the superior articular facets on the lateral masses, transverse process with foramen transverse area, triangular vertebral canal, a bifid spinous process, and the presence of the dens. So those are the features of the axis. Again, so applied aspects, we have trauma can lead to dislocation when you dislocate the dens. We have what you call burst fracture or Jefferson's fracture of the atlas. You can see that. So when a vertical force blow to the top of the head or a falling object falls on top of your head, the lateral masses will be compressed by the occipital condyles, leading to fracture of the lateral masses. So you can fracture one or both sides. You can fracture the atlas, either anterior arc or posterior arc. That leads to burst fracture of the atlas. Then you can fracture or dislocate the axis. So when you fracture at the pars interarticularis, you can see here the pars interarticularis, which is the bony column formed by the superior and inferior articular processes of the axis. So you have superior and inferior processes of axis. So if you fracture here, that's what we call the fracture of axis at the pars interarticularis. It will lead to traumatic spondylolysis of C2. So we have it's also called a hangman's fracture. So when you hang somebody by the neck, there'll be hyperextension of the head, okay, leading to hangman's fracture. So this is what we call hangman's fracture. So the C2, this is the axis. It will be displaced anteriorly with respect to C3. And you injure the spinal cord, which is here, leading to paralysis of all the four limbs. Fractures of the dens, when you give a horizontal blow to the head, and the dens, if it has pathological process, it can lead to different types of fractures of the dens. So we go to the thoracic vertebra, which I will discuss in the next lecture.